embassy hospitals, 111 hospitals. Would be our better say, or maintain another say, obesity hospitals, Baku 111. Ube funo, now we need papa. The Bashar they make and say, they would have. So maintain it, say, obesity hospitals, 111. Now we again in Ubufua. Now we know my Ghana. Name your flood, you be common sense. Over the sea, Baku 111. Abra ABCY, yen see. Enti pachewo wo de sebi previous 7 when Jimmy kakra no anka ja 111 no wow wo de jai 111 no na de yesi a yen wie ye no kwana ko complete wo de wo complete ko na we nsi dia yenim sa wa ye bia man afei another problem here yeah basic hospitals Baku 111. Kadia Adenti Eno Munjai 111. No, your hospitals are Cassia, as I said, Kolebu 37. Any G, Omunian ultra modern hospital. Said the Bayama said in paying for the area. Omunjai US, any UK call. But on my basic polyclinic and fian. Opa, not paracetamol, any vehicle. They are swat the amount. They are very coffee.
For starters, may we know, how did you come by the 101 hospitals? Was there any analysis that went into this beyond just providing each district with a hospital? Is there any sort of population-based analysis, disease trends, and so on?
We've been having problems of bringing care to the doorsteps of our people, making sure that every community has a healthcare system. If you look at our healthcare system, we have a 5-tier system that we run in this country. We have the community level, which is we call the community health-based planning system, the CHIPS. We have the sub-district health system, run normally by the maternity homes, some private health facilities, and also health centers. And then we have the first primary referral center in the district, which we take one of them and call it district hospital. And then we have the secondary level where we have specialists and we do the first specialized referral system, and then the specialist hospital or the teaching hospitals and the other specialist hospital. So this system we run in the country. And we've realized that over the years, there are a lot of problems of districts, regions having hospitals. So studies were done, look at the demography, we look at the epidemiology of all the various parts of the country. And we realized when Ghana Health Service was asked to do the survey, we realized that we have 88 of the 260 districts in this country without any semblance of a hospital. That means that there are some of them which are not in the urban areas or peri-urban areas. There will not be even a single health practitioner or physician in that district. And there are a lot of districts like that. And there are some of the regions without even a single specialist in the region because they don't have anything we call regional hospitals. So we came out with Ghana Health Service came out with a report which the ministry brought, and then we discussed, and there were 88 districts without hospitals. That's why, if you remember, last year, the president was talking about Agenda 88 because he wanted to fill in that gap as quickly as possible. I'll quite agree that since God's best time, every government which comes to power wants to have these hospitals built. But this government, His Excellency President Akufo-Addo, took the bull by the horn and said that, look, I'm going to fast track this. And if he said even within 1 year, he wants to do this as quickly as possible. Then later on, we realized there are some of the districts where if you look at the geographical spread of the district, there's west and east. So if you put the hospital in the district capital in one part of the district, the other people will also suffer. And there are some of the municipalities which are also springing up quickly. So the district hospitals then increase after discussion to 101. So the Agenda 111 consists of 101 district hospitals. And the president then also reminded everybody that, look, we should have a holistic health system. What about psychiatric hospital? Because this is a country where the only psychiatric hospitals we have are at the coastal level, one at Akufo, and then the old one at Accra Psychiatric Hospital and the Pantan Hospital. So he said that why don't you have psychiatric hospital also added, even though psychiatry is supposed to, or mental health is supposed to be decentralized even to the district level using the mental health nurses. We should have a specialized or specialist mental health services for training and research, and also for management of very specialized cases. So we decided that we should put one in the middle belt and then one in the northern belt. So 2 psychiatric hospitals were added, one in Kumasi and then one also in Tamale to serve the northern, the middle and then the northern belt respectively.
Yeah, good to know.
So it was 103 hospitals.
Right.
Then these 6 new regions which have been created with that hospitals. So the 6 new regions were supposed to be provided with hospitals.
Okay.
And then Western region, because of the way it is, Western region is now growing, that if your Kwanta hospital should be refurbished into district hospital for the secondary Takoradi metropolis, and then new hospital will then come to Western region.
Okay.
So if you add, and then Accra Psychiatric Hospital is supposed to be redeveloped and then refurbished and
good to know about the research, that informs the need. But already there's celebration within the NPP and some quarters of the populace. I've sat on this program for over a decade, and I will tell you that the last thing I'll do is to celebrate sword cutting for a grand program by politicians. I have seen just too many that have remained just promises and unfulfilled. Where is the financing from? How are we going to ensure these don't become white elephants? Why are we not completing those that have already been commenced and are there, those that don't have fully functional, equipment yet? Have we worked on who are going to populate these hospitals to man them over the period?
Yes, Samson. As I said, this is a project which is very dear to the heart of the government, and for that matter, His Excellency the President. And for that matter, everything has been done. Maybe people have been asking why didn't it come on last year, as the President mentioned. But we were locked in room to come out with a design which will fit the districts and the regions. It's a fit for purpose, well equipped, and then state-of-the-art hospital so that it serves the purpose that it's supposed to serve. So everything has been thought of very well. And the hospitals have been divided into 2. There are a group of them which, for effect, we want to finance it through, or government wants to finance it through Ghana government funding. And that is the 101 district hospitals and the psychiatric hospital. It is done in such a way that hitherto there are hospitals, if you see the hospitals which are being built, the 10 key projects, which I'll come to, because you are asking questions about why haven't you finished hospitals, or some hospitals are not being finished and all sorts of things. Hitherto, this cost of those hospitals, because it's a 10 key project, they come with their own drawings and everything, and then bring the hospitals to us, and then we build. It will interest you to know that the cost were ranging between 26 million, 30 million, some of them 34 million. This, the President said, we are going to put up this district hospital, 101 district hospitals, and there was even a fixed price that was given. It shouldn't be more than 17 million per one, which means that we have to have a hospital which will fit about 8,000 square meters space, and it should be functional, well-equipped, state-of-the-art, fit-for-purpose hospital at this price. And these were all done in such a way that we will have the funds, and then it will be done in such a way that it will not be done as is in some of the hospitals which are started about 1945 or 1974. So these are some of the things that we have been put in place. So the funding for the district hospitals and the 2 psychiatric hospitals is from Ghana government. If you guys, immediately the government mentioned it in April last year, there was a mid-year review budget, and an amount of 100 million startup fund was put in 2020 budget. That's mid-year review budget. That money has been made available. Normally, when monies are allocated for projects and the budget year ends, sometimes the money goes back to chest and used for other things. But this money, as I speak now, have been allocated as seed money, and it is being taken to Ghana Infrastructure Investment Fund. So they are going to manage the funds for these projects. And we are very sure that because of the way that gift is structured, there will be enough money. And this year's budget also, some funding was also allocated, which will also be added. And then we are going into the next year, 2022 budget cycle. Funding will also be made available, and then we see where we go from there.
So the expectation is that all these 111 hospitals will be completed by when?
The 100 and the district hospitals will be completed, as the president said, on the 17th of August at Trede in Ashanti Region, that from the start that the contractor goes to site, it should take 18 months for the hospital to be completed and commissioned for use.
And these will all be executed within the next 3 years of the term of the government?
That is going to definitely to happen. The president normally says that he wants to commission all this and commission it before his term of office ends. And he means what he wants to do.
Yes. So I was asking, you are saying that the money includes equipment and everything. So this will be fully fitted?
Fully fitted, yes. So there are two types of hospitals that we are going to do. Looking at the demography, there are 60-bed hospitals, which the construction cost is lower than the 100-bed hospital. I think 100-bed hospitals are about, the construction is about 12.4, and then the equipment is standard. About $4 million have been earmarked for equipment.
All right.
So it comes 1.4. We run it about 17
million. So
million.
I asked the question about human resource, doctors, and I often refer to this revelation that I was shocked to discover. In 2005 thereabout, I did a documentary for the BBC on brain drain, and I was shocked, really shocked to discover that the number of Ghanaian doctors in New York only outnumber the total number of doctors we have in Ghana. We're reading stories about brain drain even at the highest level now in some African countries, including Nigeria. I don't know exactly the situation in Ghana. What's the plan to populate these hospitals with personnel?
The plan, we are planning how many the personnel, which especially the health professionals, which will go into all these hospitals. Samson, there are about 3 things that why health personnel or health professionals migrate or brain drain. One is job satisfaction and job security. You see, every doctor, I'll talk first about doctors and nurses. Every doctor who finishes school first has an ambition that I want to do specialization in this and this and this. So that's the first thing. Every health professional wants to get a place where the environment is good, you have the equipment and everything to work off. Every health professional who is asked to move to a place or posted to a hospital would like to go to the place and get maybe a place where he will put his or her head. And about another other thing is that also the remuneration which comes with it. I have a very strong belief in my heart that a doctor working in Accra should not receive the same salary or the same remuneration as a doctor working in my village. The fact being that the doctor working in Accra during his spare time may have some private hospitals where they can go and practice. So if you have a decent accommodation, you have what we normally call a hardship allowance or rural allowance or hard to reach area allowance. And then the doctor have somebody who is supporting him or her. And also he can also do postgraduate, even which is decentralized at where he's working. And now that we have digitization of e-health, the person can also have support from seniors and from specialists in other hospitals. we doctors are not very difficult people. We normally become satisfied with whatever we are doing. So this is what these hospitals are going to do. First, they are well equipped. We are also thinking seriously even about the management of these hospitals, because you can put a very beautiful hospital. We have people who are working there. The management system is also very important. And the doctor who is in one of these rural areas, hard to reach areas, will have an allowance, which have all been worked out. And I'm sure the ministry is looking at it and to go to finance for approval, will get that top-up salary, and he can sit at wherever it is. It's done everywhere in the world. If you go to Germany, it's there.
Okay.
And you can
right, Doc.
Start doing.
Yeah, Doc, is this your problem with this 111 hospitals?
The way and manner it has been procured, we are of the view that it hasn't been open, and would want to know from the PPA what the process was. We know, I mean, being in the industry, that procuring works and services for works cannot be considered urgent. The reason being that there are a lot of players that come into it to get a hospital running. So you first need to get consultants in place, then you go to the contractors, among others, before construction can start at a site. And when construction also starts, that's what we call supervision. So we would want to know what has happened until now, and going forward, what is going to happen.
Ken Ofori-Atta, the finance minister, was in parliament and said that government had engaged over 20 local consulting firms through a lead project consultant to provide architectural and engineering designs, as well as project management support towards the execution of the projects. Were you not aware of this?
Yes, but how was it done? You see, you're talking about a huge government project. You're talking about using the public purse to procure services. How was it done? Was it done based on any quality, quality selection process, or were they picked? Yeah, there was a need to have a national coordinator that can be appointed. Okay, but after that, what process was used to select the 20 consultants? Remember that we have over thousands of consultants or professionals within the built environment in the country. Not everybody can be on it. But when you talk about 20, no, to be honest with you, I wouldn't, if I were Ken Ofori-Atta, I wouldn't have said we procured 20. And what was the process? Was it open? Was it advertised for thousands to express interest?
You have issues, so you should be telling us. You have issues. You have raised the issues. You should be telling us.
We didn't see anything in the public media, in the newspapers, on PPA website, whatever, that this project is being advertised for us to respond to, and to be shortlisted or otherwise. Okay, so I think that call would have to go to PPA for them to tell Ghanaians how that thing is done. You see, we're looking at not today, but we're looking at the future. Remember that we're not talking about only architects. We're talking about procurement process. And the process, we have institutions teaching procurement. What case studies are they using to teach them so that they understand best practice, and when they come to the working field,
from your examination, what has gone wrong? Can you name it?
Yeah, from my examination, we think that they haven't been open. They They haven't been open it up for all to express interest and and support the project or deliver the project.
You think or that is the fact? You think or that is the fact?
You know, we do not have the documents from PPA to enable us to talk on authority, but we didn't see anything in the public domain as this project is being advertised and that professionals are being encouraged or requested to express interest.
So where do you think you are now? As far as the local architects in the country are concerned, you think the stables doors have already been shut, the halls have bolted?
No, well, okay, so there are, this procurement of works go through processes. And for consultancy, we have what is called pre-contract activities and post-contract activities. The pre-contract activities talk, is what has been done, not know whether it's been completed, but once a sort has been cut for one, then that has been completed. But there was also the post-contract activities, which is got to supervision and then contract management. Along the line, we had put, when we heard about the news for the 88 district hospitals, we had requested our members to express interest. So we put out a communication to our members, and about 27 of them expressed. I think there were more, but we use our our systems, and we had 27 who we knew or we know are competent to be engaged on the post-contract services. So in November 2020, we had been discussing and communicating with the national coordinator. So in November 2020, we wrote to the national coordinator and issued the list of 27 architectural firms and architects towards the post-contract services.
What do you want to be done? What do you want to be done now?
I want to say.
I'm losing you. Hello, Foster. Okay. We have very limited time. Let's have. Yes, Foster. Sorry, your line is disappointing us. What are your issues?
To hear.
He's trying to speak, but his line is not helping us. And I'm sorry, but that's all time will allow us for now. Alex, let's hear what your concerns are with the process.
First of all, I think it's, and I use the word advisably, but the level of deceit that we are going through. In April 2020, we had a very detailed broadcast by the president himself, indicating that all works had been done and they were going to build 88 new hospitals within 1 year. At what point did this change? And if it was done in a COVID broadcast 88, and we are now at COVID broadcast, COVID broadcast 8, and we are now had 26 updates. At what point did the president realize that we were not going to do 88 anymore? And why didn't he tell us in the COVID broadcast? Why has it now been shifted? When the 1 year is passed, we are now 16 months down the line, and we are being told now about Agenda 111. So what has happened with the 88? Oh, it's been subsumed by the 111. For 1 year, you couldn't tell us it was going to be subsumed? That is issue number one.
Are you also pretending you don't know that the COVID broadcasts were turned into political campaigns?
Well, I'm saying that I believe, it was a political campaign. We know. But some people may not understand it, so it should be made clear that the 88 hospitals have not been built. The 111 agenda is very different from the 88 hospitals. People are trying to merge the two. For me, I don't merge them. 88 hospitals, 0. 111, we are beginning to start counting the 18 months. And therefore, it affects or raises the reason why we have skepticism against it. You raise the second point, which is very important. The total amount is in the region of approximately $1.8 billion. Let me be generous, say $1.7 billion. We have had $100 million of that money available. If on their own estimation of 17 million per hospital, to get us 6 full hospitals, not 7, 6 full hospitals. So it means that we are left, and that is on the assumption. I'm not only talking now about the 101 district hospitals, because the price of the psychiatric hospitals and the price of the regional hospitals are definitely not in that price range. So just working with the 70 million on his 101 hospitals, where is the rest of the money? And we are told GOG, which is a term to mean that government to raise the funds from its own revenue resources and finance. Really? I've sat in that chair before. Excuse me. It is not a simple thing as is being put out that we are going to build 111 hospitals in 18 months, even with prefab and all that issue.
You are being reminded that this is your attitude that greeted free SHS. Now,
I thank you for the reminder. Are we celebrating free SHS? As a people, is it because people are out there shouting free SHS that we have succeeded with free SHS?
That's largely done well.
Really?
So it's not perfect, but I mean...
well, if you feel that free SHS has done well, so be it. We still have the traffic light system. How many years after? In the wildest imagination, for me, free SHS cannot be celebrated. As a concept, you see, I never have a problem with the ideas that the MPP come up with. Free SHS, 111 hospitals, fantastic idea. Let's do it. It's not a new idea, but the way it's been packaged and the concept that has come is new. I'll do it all at once. Free SHS, it was a new idea. It's within even our constitution.
JM was implementing it.
So, good ideas, but it's always the implementation I have a problem with. It's always the implementation. That's my view. And I'm saying that if you cannot tell us clearly where Sofo line interchange was a government of Ghana, this thing started by President Akufo. Do you know how long it took us to finish that because of finding funds? We are in a COVID era where we are looking for money and handouts to help us to sort our economy out. You're looking for 1 billion for ACA to go and buy oil. Your free SHS they are talking about, which is on its knees, but we have to manage. Teachers are saying they are not being paid well. School feeding program, the children are not getting schools, and we are clapping for free SHS. Good idea, bad implementation. If you need money to go into those things, where are you going to take 1.7 billion to build hospitals in 18 months? And that's the key. In 18 months.
We are taking $1 billion to do the multi-purpose dam.
Polygu.
Yes, in Polygu. You haven't questioned that because Dr. Bamia will tell you, you are thinking impossibility. They are thinking possibilities.
So we are not taking how many dams have they built? We, in the end, came and we finished it off, and they built it. We gave them. It was a Kwame Nkrumah idea. It's not an MPP idea. Kwame Nkrumah started. MPP came, put it into operation again. We came and finished off. We clap for them, no problem. So if you have given them and you say you're going to do it, there's a record. What is the record of the 88 hospitals? 0. So if you are using that record as your benchmark, there should be skepticism that you cannot build 111 in 18 months because you didn't even build 10 of the 88 for us to say that, oh, you changed your mind in between. You didn't build any at all. You wanted, it was an election gimmick.
Okay.
So, I mean, but let me just come back to, before I know this time, I just want to touch on 2 little things.
Because you guys are raising questions, and I need Dr. Nsiasari to answer them. I have just about 3 minutes.
Okay, can I just mention the issue? You see, we love his work. We want to give him credit. But the David Adjaye issue is creating a problem. Our friend is being diplomatic with his language. The question is, was this dealt with through proper procurement processes? There's a list, I don't know how true, but it should be interrogated and some answers should be given because this type of decision should not be left to hang. We are told that the trade fair company is doing some work. that contract is, we are told, the architectural contract may be with David Adjei. If was Salanan Children Park, we are told it's maybe with David Adjei. The Parliamentary New Chamber, David Adjei. Marine Drive, David Adjei. The Oil City in Takrady that we are supposed to be looking at, David Adjei. GMPC office in Takrady, David Adjei. Bank of Ghana office, David Adjei. Airport City project, David Adjei. Railway terminal, David Adjei. Ghana embassy in the US, David Adjei. Agenda 111, this one, David Adjei. In order that smell goes away, they should just come and clarify that this is not true, these are not true, and even if it's true, this is the procurement process we went through, especially on Agenda 111, to put our minds at rest, because he's a Ghanaian, he's very good, he's won awards, and if he has been able to go through a process which means that people have decided to pick him, so be it. But you will not hear somebody from the architectural place coming up to speak on this program if there were not question marks.
Yeah. Dr. Okoboy has been explaining that the amount of $6 million
yes,
did not all go to David Adjei. He explains that there have been a number of activities and consultants involved, and it says quite a number of activities that went into it. We have the project consultant, the topographical survey, and geotechnical investigations. This is part of the pre-contract services. There were visits to the 88 sites across Ghana, preliminary designs completed and approved by the Ministry of Health, detailed designs and specifications. So he talks about price bail of quantities, conditions of contract, everything. He says it's not only for David Adjei, so people should not be getting it that wrong. Dr. Nsiah-Asare, forgive me, yes, but I have just a minute. What can you say to the concerns of the architects and what Alex is raising?
First, I want to tell my brother Alex, Honorable Alex Sebefia, that in one of the updates of the president on COVID, he mentioned that Agenda 111, not only when he was cutting the sword. So the 88 district hospitals we are going to build have been gone into the Agenda 111. I think I've explained it quite enough.
That's right.
And yes, and the second point is that I think my brother Foster also made it very clear that they asked 27 of their architectural firms to see the project, the lead consultant, which is the Hospital Infrastructure Group Limited. So I think there's a process, and PP has gave approval to government to engage Ghanaian architects, engineers, and also designers, building quantity surveyors, and the rest.
Okay.
David Adjei did only one aspect of it. I think David Adjei was the one who did the architectural drawing for 101 district hospitals.
Okay.
There's another group of companies who did Centerland and Sutherland architects who designed the Accra Psychiatric remodel.
Dr. Nsiah-Asare, I apologize very sincerely, but time has run out on us. We should be able to continue with this discussion, as some architects even are sending me questions comparing prices of what happened in Shama and what is happening now. Thank you also very much. My outfit is by Habil's Couture. Habil's Couture is found at Ajiringano Gate, East Legon. You can call them 0200 841 988. 0200 841 988. And my guest have been Alex Sebefia, Director, NDC International Relations Directorate. Martin Pebu. Martin, my apologies, we couldn't get even a comment from you on the last issue. He's a rights activist, he's a lawyer. Dr. Anthony Nsiah-Asare, Presidential Advisor on Health. Foster Osai Akono is Vice President, Ghana Institute of Architects. And earlier, we have Dr. Akwete, Executive Director, Institute for Democratic Governance, IDEC, and Dr. Kwame Asa Asante, Senior Lecturer, Department of Political Science, University of Ghana. I'm Samson Ladi Anyanini. Have a good afternoon.